Hello, my name is John Lewis. I'm faculty at Emory University School of Medicine, and today I will be presenting the Workplace Economics and Employment Shift Work submodule. First and foremost, a disclosure. The creators and presenters of this educational material have no actual or potential conflicts of interest in relation to this program/presentation. All images are used by either permission and or licensure. First, our objectives. We're going to describe how shift work increases the risk for disease and injury. We're going to name specific diseases that shift work increases the risk for. And we're going to recognize how shift work can affect the social drivers, specifically in domains of access to quality healthcare. We're going to learn strategies to mitigate the negative effects of shift work. And then we hope we will come away with an understanding of the importance of personal and policy wellness advocacy for shift workers. Definitions and primer. Shift work refers to a work schedule that is performed in rotations, often to cover a 24-hour period. This is due to globalization. Increases in shift work are a result of a growing expectation for 24-hour business models that cross various timelines, such consumerism requires workers to provide services and products continuously in order to prevent service and supply chain disruptions that result in negative impacts to revenue and growth business models. Shift work is also likely to increase due to globalization. Next, sufficient evidence exists to label shift work as a probable carcinogen. This is by the World Health Organization in 2007. When we normalize for other factors, shift work appears to increase the risk for various diseases, including cancer. Primer continued. Night shifts and rotating shifts are the greatest risk to one's health. Circadian disruption is a primary cause of disease. Melatonin, cortisol, and immune surveillance play key roles, and negative effects increase with age and duration of shift work, meaning the number of years you participate in shift work. Now, the background. It's theorized that cortisol surges from shift work increase the prevalence of coronary artery disease, CVA, and type 2 diabetes, along with metabolic syndrome and obesity, as well as hypertension. Impairment in immune surveillance from shift work is theorized to play an important role in the increase in malignancy in shift workers. And then lastly, longer careers in shift work, once again, and increasing age of shift workers are directly proportional to increased likelihood of harm. We now know that 15 to 30% of U.S. workers, or those employed in the U.S. workforce, are employed as shift workers. This is probably underestimated with the new globalizations due to large multinational corporations and desires and consumer models that require supply of goods over a 24-hour period within short turnaround times and time spans, 48 hours or less. No industry will be named, but certain ones should come to mind. Now, there is increased risk. Here's the ticking time bomb. We know that there is an increased risk of disease as mentioned before, but what are they? Well, let's go through it. Obesity, preventable injury, substance use disorder, diabetes type 2, which has a 20% increased risk, and cancer, lung, breast, and ovarian. But there are more. We previously mentioned CAD. CAD has an 11% increased risk for shift workers. These are relative increases. Depression has a 33% increased risk, and preventable injury also can be increased up to 4-fold in shift workers. We have left off other things that cannot be ignored, including cognitive impairment and, as mentioned before, stroke. Now, we talked about these things, but we haven't talked about how they affect us differently depending on our sex. Increased risk of miscarriage is associated with shift workers, up to 23% of an increased risk in women who actually work during night shifts. Preterm deliveries also increase 21% with night shift workers. And then here's the increased risk for death from all causes, 7 to 30%. Now that's wide, but it's still significant because it's death from all causes. This data comes from the Journal of American Heart Association, and it was published in 2022. Mortality from all causes is increased in shift workers. Now, contributing factors to injury and harm, worker fatigue. We see it as a significant contributing cause to industrial disasters, injury risk, increased medical errors, and increased cost. This is from the Bureau OSHA, basically the United States Department of Labor put out these statistics, and this is a little deeper dive. We now have data that suggests that industrial disasters in the form of the 2005 Texas BP oil refinery explosion, the 2009 Colgan air crash, the explosion of the Space Shuttle Challenger, and nuclear accidents, including Chernobyl and 3 Mile Island, were partially a result of worker fatigue. Increased risk of injury among full-time employees in relation to the number of hours worked per week has long been established. The longer you work, the more likely you're going to make a mistake. That is common sense, but the data supports it beyond common sense. Errors in patient care, increased needle sticks and exposure to blood and other bodily fluid, and increased occupational injuries are associated with worker fatigue. And then last but not least, there is a financial argument to be made. Remember this. Direct or indirect links to increased cost. This stems from the loss of productivity, increased injury, and increased time off the job due to illness or injury. We saw this during the pandemic very much so. The first frontline workers were very vulnerable to this fact, and this resulted in increased worker compensation costs. It also results in increases in annual costs, billions from fatigue-related, health-related loss of productive work time is also documented as attributable to worker fatigue. So this is $1 billion problem, and this is the language we should use when we're proposing a solution to this deadly problem. Here are the mitigation strategies. If we're going to talk about the problems, we must be willing to talk about the solutions. So first and foremost, sleep schedule. When you are a shift worker, you should try to stay on the same sleep schedule every day of the week, if possible, even on days off. Now, that is hard. We realize that. This is also difficult due to something we call shift worker sleep disorder. If you work rotating shifts, you know what I mean. You can't go to sleep at this time. You just can't seem to fall asleep. But this is one of the strategies if you're a consistent shift worker without rotating shifts. Light avoidance. If you're coming off a night shift and you're going to bed in the daytime, wearing dark glasses and special goggles can help workers when the daylight will often reset your pineal gland and your melatonin levels are all over the map. Light cues can be mitigated via darkening and blackout curtains, and this does prove to have some beneficial effects. Extra time to sleep, basically a sleep buffer. Account for the days that you're coming off a string of rotating shifts and build a buffer when you have to swing back to a non-circadian pattern. Basically, you're coming off the evenings, you have to go back to days. Make sure there are enough days in between to do that. Without reducing your sleep time in total. Still try to maintain your 7 to 8 hours of sleep when doing this. And then delay going to bed and waking up. On the last few days of an evening shift, delay going to bed and waking up to reset and allow for a significant quantity of sleep. Very often we will cheat our sleep. We will try to go to bed and then get up at the same time, often cheating our sleep, or we will go to bed early and wake up late. And sometimes that can throw off your schedule as well. So try to maintain this delay in order to accommodate the 8-hour bracket that is required. Yeah, work needed. That's a little bit of a pun. These are barriers to access of care, as we described earlier, we're going to talk about. People might miss appointments due to shift worker sleep disorder. They may oversleep during the time when they should be awake or when their doctor's appointment is taking patients. There's also no access to care during their hours that they're working or not working, I should say. There's and difficulty coming into a place when you're working and rotating shift schedules. And when they're open, you're sleeping, and when you're awake, they're closed. You might also have, or one might have, childcare issues or caretaker issues with these types of schedules, making leaving or taking care of their own health difficult. This may require extended or weekend hours for primary care appointments in order to facilitate people's occupational schedules. And then last, the ED may be the only access to care because we are too a 24-hour business. And we must be sympathetic because we are both suffering from and also the answer to this problem. Well, how do we remember and how do we fix this? I like this little acronym. Our job equals a riot. First, A, we must advocate for healthy solutions, both at the job site and extended hours for those who will provide care, primary care specifically. We also must advocate for evidence-based wellness scheduling. I know this is easier said than done, but this is part of the answer. You can't not get what you don't ask for and what you don't demand. R, recognize. Recognize that shift work is a barrier to health in the form of access in the minimum, as well as increase to risk of injury, disease, and death. We must identify shift industries in our communities so we can identify where the disease burden may lie. That being said, ask where your patients work. Ask the type of work they do. This may give insight into their difficulties in accessing care and why they're coming to the ED, and how you might be able to give them insight in at least mitigating some of the shift burden. Oh, obtain a work history in the ED. A simple screening question. Where do you work? What type of work do you do? Can give tremendous insight and focus to where root causes may exist as far as diseases, as well as disease prevention and injury prevention. Then T, talk. Talk to stakeholders, making the financial argument for change in supply chain, injury prevention, and productivity. If by doing this, maybe we can eliminate some of the upstream causes of injury and harm attributable to shift work. Lastly, we must recognize and address the ongoing damage within our own field. This is not new from the pandemic, but it was definitely highlighted in the pandemic. We cannot get others' house in order unless we get our own house in order. So let's advocate for one another. We know better. Other industries are doing better. So can we. Here are the references. They are supplied within the module for you to do a deeper dive. And here are some links that are also within the module for further work, study, and hopefully advocacy. Thank you for your time and be well.